Biggest thing is just cost. Cost is just outrageous.
I worry about the high premiums, and then along with that, the high deductibles.
I pay 25% of my income to insurance. That is a broken system.
For low-income people, I think sometimes you have to make that decision. Do I buy my meds or do I not buy groceries?
It seems to me that health insurance companies have become too Darwinian in nature, and they look for any small illness or injury or family history to deny coverage or to raise the premiums to where you can't afford the coverage.
I have 3 children who have life-shortening illnesses. They go off of my insurance. They are uninsurable.
I don't believe the person next to me that is unemployed should be denied.
I work for a small business. 3 full-time employees, 1 part-time employee, there's no health insurance.
We've got to change. This has got to be fixed.
What do you like about each scenario? What don't you like about each scenario? And then eventually, what do you want?
If you're driving a vehicle, you have to have insurance. If you're walking the face of the planet, you have to have catastrophic health insurance.
The health system is really based on humanity. It's what we can do together to provide good care, and we're talking about the state, for Kansas, so that we can tell people, you know, Kansas is a good place to live. We take care of one another.
What we decided basically it would be the best program to make a system that's everyone's eligible for, and everyone needs to participate.
That's the American way. We are covering the people who can't pay, and our group felt that everybody, regardless of whoever, they should have quality health care.
Everyone covered. Does that mean illegal aliens that are in our country illegally? I don't think we should cover any illegal aliens, period. Okay. Zero.
All right. All right. Other thoughts on this?
I have a thought on that. Anyone who works here is going to be paying taxes.
That's what you think.
I'm sorry, but they will.
How many of them work for cash?
Dialogue, please. Dialogue, not debate.
If somebody has TB that's not treated, whether they're illegal or legal or from outer space, and I get it from him, I'm going to be unhappy. So that's the reason I want to help everybody.
We need high-quality professionals in the system, so we want to make sure that we don't discourage, the system doesn't discourage the best doctors, the best nurses, the best healthcare professionals from wanting to live in Kansas.
And there were no restrictions on the doctors. We had our choice as to who our provider would be.
We also want the ability to purchase additional insurance on top of a basic type of plan that would be in place for everybody in the state.
It says all Kansans will have a medical ID card that carries an electronic record of their medical history and prescription medications.
Yes,
that's a good thing, because see, if you go to a doctor and they need to know, what kind of medicine you've had in the past, and if you can't remember it,
Or you're incapacitated because you're in an accident. Right?
Exactly. Right there, that card would have all that onto its file.
But I do think people that don't smoke would get it, I go for that lower rate.
I think that's
don't
very
smoke.
good.
It's the same with life insurance. If you don't smoke, you get a lower life insurance rate.
So increasing personal responsibility is going to have an educational base.
I believe some kind of reward should be given for like screening or checkups, almost like for instance on auto insurance, like a safe driving record.
Income tax incentives for people who participate in wellness activities, whether that's, maybe attending a class on diabetes if you have it, or participating in an exercise program.
If you have punitive punishments, that means the state is actually actively going out there and they have to find, search it, prove it, and then enforce it. And that is, every step of that is going to increase costs.
We really like the idea of medical cards and electronic systems so that doctors would be able to have access to knowing exactly what medication that patient may have been on.
We want an emphasis, again, on preventive care.
We do believe a lifelong wellness program that would start early and maybe as early as preschool and would continue through all phases of education.
Whatever that organization gets to be at state level, they should have a very strong hand in negotiating drug prices, supplies, etc., all through the health chain.
Who pays? It's going to be income tax, right?
I don't know. What other option is there? I don't know. How else would you do it?
You could do income tax, you could do sales tax, you can do
What other taxes?
Property taxes. Talking about sales tax is going to hurt the lowest economic bracket because you start taxing basics.
I don't like taxing sales tax, just like you said. Like, why raise the price of bread?
That's why we need to put in there a sliding scale based on income.
Who will be able to buy supplemental?
Those who can afford it.
What if you lose your job?
Go to another job, have the same tax taken out each time you go to a job. That's kind of like a federal thing.
What about when you're in between the jobs?
Well, then, what about that one I hadn't thought of?
None of us wanted a tax at all. You know, we're sick to death of taxes, but we realize that we're going to have to pay for it somehow.
We agreed that we would consent to have our taxes help pay for everyone to have insurance.
I'm assuming the economic assumption here is generally if everyone participates, then the overall cost of the premiums should go down.
The most surprising, pleasantly surprising experience here today is that someone is thinking rationally and thinking across the board about improvement without the platitudes.
The most surprising thing is I figured that I'd come in here and everyone would be fighting at each other and reaching over to strangle each other and wouldn't have the same viewpoints, but everybody in here from all different walks of life, just like Robert said, has the exact same problems.
I was really surprised at the diversity that we had in this group and how, although we were so diverse, we all shared the common feeling that we need to take care of everybody.
I think the most surprising thing was that we were willing to pay more to have absolutely every single person in Kansas covered.
Almost everybody in this room, I think, is in agreement that we need some type of universal health care coverage. I think that's surprising to me because of the demographics I look around this room and see.
I think I'm coming out of here leaning more towards a state program, and previously I would have been opposed of anything that smelled of socialism.
It appears as though we collectively as a group have enough faith in our government that we're looking to them and saying, hey guys, get on this and get it fixed.
Key message I want to communicate with decision makers is please leave room for choice.
If I'm willing to pay for it and other people are willing to pay for it through taxes, there's no excuse as to where the money can come from.
I am pleased that we are finally getting people at the state level to perhaps listen to us at the grassroots level, and I hope that the one message that we can get them to understand is that we really have reached a crisis point in Kansas with health insurance.
I think if we're a well state, then I think we're going to be a more productive state.